Hi everyone. First of all, if I stand here, am I blocking anyone's view? I can't tell. Or can everyone sure? Is that better? Yeah. Right. Okay. So welcome to my presentation. I'll talk about my PhD research project, which is about internet use in people with lung cancer prior to diagnosis. And I'm based partly at the School of Nursing and partly at the School of Computer Science, so it's like a cross-disciplinary project. So first of all, I'd like to outline the background and the aims. So what you need to know about lung cancer is that survival rates are extremely low compared to other types of cancer. As you can see in this figure, lung cancer is all the way down here. It has the second lowest survival rates. If you compare it to, for example, testicular or breast cancer, where survival rates, these are 1-year survival rates, they're over 90%. In lung cancer, it's about 30%. And with 5-year survival rates, this is even more extreme than lung cancer survival rates are at about 80%. So, why are these survival rates so low? Well, as with any phenomenon, there are a multitude of factors. Some of these are medical and related to the nature of the disease, but some of these are also behavioral, because there tends to be a delay in diagnosing the illness and in treating it. And since my background is in psychology, I focus on the behavioral aspect. So, when there's a delay to treatment, the cancer will tend to be at a later stage once it's treated, which makes it more difficult to treat. There are 3 different points at which delay can occur. Firstly, the patient can delay, for example, if they take a while in realizing that they're actually ill. The practitioner can also delay, for example, if they don't diagnose the illness correctly at first. And there's also system delay, for example, when you have long waiting times for patients to be referred on to specialists. In my project, I'm going to focus on patient delay, because the other 2 forms of delay have already been researched extensively, and there are interventions underway to improve this delay, whereas interventions are still needed to reduce patient delay. So, why do patients delay? There are several reasons, and at the heart of this is the fact that symptoms in lung cancer are very vague. They include things like a persistent cough, breathlessness, fatigue, and weight loss, which could be related to a number of other illnesses. So really often people attribute their symptoms to another illness at first. Also, awareness about lung cancer symptoms tends to be quite low in comparison to other cancer types because they're not very specific. It's not like with breast cancer, for example, where you have something specific like a lump. Also, a lot of people, especially elderly people, are worried about bothering their doctor because they think that they're very busy. Then also the group most affected by lung cancer tends to have low health expectancies anyway, so people who are older or smokers just don't expect their health to be great. And then there's also fear and denial. So sometimes people suspect it, but they're scared to have it confirmed. So how can we tackle this problem? Well, one way of tackling it is by improving awareness of symptoms. But to effectively do that, we first need to understand what information sources people actually use to get informed about their symptoms. And so lung cancer patients report using various health information sources after their diagnosis. For example, they talk to physicians. On second place is the internet. They also talk to family and friends, etc. But the issue is, this is after the diagnosis. What we don't know is how people use the internet to appraise their symptoms before the diagnosis. There's no research on that. So that's what I'm interested in. I'm interested in, do people basically sit down at home when they start having or perceiving symptoms do they sit down at their computer and type them into Google? And how do they go about their search? What websites do they find? And how does this influence their decision to seek help? So here's an overview of my overall research project. I'm going to start by conducting a survey with lung cancer patients, and I'll also conduct some interviews. I also want to systematically review websites to check how accurate the content is, how current it is, etc. And I'm also going to be analyzing website usage of lung cancer charity websites. This is where the computer science bit will come in more, because I'll be analyzing what links people tend to click on, how long they stay on certain sites. My first year, I will be focusing on the survey and the interviews, so that's why I'm going to be talking about that from now on. Great, so this is an overview of my design and measures I'll be using. As I said, I'll be working with lung cancer patients and recruiting participants from local cancer centers. And I'll ask people to complete a questionnaire. And participants should be diagnosed no more than 6 months before the study took place, because I will be asking them about activities that took place before their diagnosis, so it shouldn't be too long ago. And this questionnaire will ask social demographic information about health status, and which information sources people used before their diagnosis. This data will be analyzed quantitatively, and also I will be sampling purposely from this pool of participants for further interviews, which I will analyze qualitatively. So basically the questionnaire acts as a screening so that I can identify people who use the internet and those who didn't use the internet for their symptom appraisal, and make sure that I have both groups for my interview. So my quantitative data analysis is quite straightforward. I'll be using linear regression to identify variables that predict patient delay. And specifically, I'm interested in whether the internet internet use for symptom appraisal predicts patient delay, and if so, how. Because there are several ways the internet could facilitate presenting to health services, but it could also act as a barrier. For example, if people are led to think that they can treat their symptoms at home. My qualitative data analysis will focus how and why people use the internet to appraise their symptoms, or why not, and how this influences their decision to seek help. I'll be analyzing it using in vivo, using framework analysis, and I'm going to try and identify themes and sub-themes, and how they relate to generate a theoretical framework for understanding the role of the internet in this process. And I'll be recruiting more participants as I do my data analysis, if I find that, for example, I need to elaborate on a certain category more. And I'll be continuing until that data saturation is reached. So that means until I find that no new information comes in from my interviews. Great, so last but not least, I'd like to talk about the impact of my study. So the knowledge that I'll hopefully gain is what role the internet plays in seeking medical help. Is it a facilitator or is it a barrier? And also what features and what type of information people find helpful in informing their decision, and what they find less helpful. And overall, this information will hopefully in the future be used to inform a web-based intervention to promote early presentation. And so this website idea that I have is, I want it to be an interactive type of website with tailored information, because a lot of people report that they tend to be overwhelmed by all the information. So here's an example of, this is a website for people with balance problems. And before you enter the website, you actually enter some information about yourself. and then the information is tailored to your needs. So that's basically the kind of idea that I have. Yeah, and that's it. Thanks for listening.
Flip.
What is a positive subsample?
Oh, sorry. Right. If you sample purposively, that means that. Sorry, I should have explained that. Means that you recruit your participants based on certain principles or certain characteristics. So, for example, for my interviews, I want people who use the internet for symptom appraisal and those who didn't. And I also want people of varying age, gender, educational level, because those variables tend to be related to internet use. So I want to make sure that they're all in there, so yeah, be sampling them purposively as opposed to randomly. Okay.
So basically your main focus is on looking at the internet and this kind of like diagnosis kind of side of not really diagnosing cancer properly.
Yeah, although I'll be looking at the stage before people actually go see the doctor.
Yeah. So you obviously think that may be the main cause of them not wanting to go to see the doctor, for example, because they've read something on the internet because they think they've got lung cancer. So would you say that that's the main cause of why they don't go and see the doctor? Or would you say that you think that there are other factors do play a role in that?
I think that could be one possible factor, but it's hard to tell because of the paucity of research in the area. I think it's going to be people misdiagnosing their own illness. It's also going to be partly, as I said before, things like fear and denial, worry about bothering the doctor. I'm actually conducting a systematic review at the moment to identify factors related to patient delay, so I have to see what comes out of that, but I think it's going to be an interplay of several factors. Does that answer?
Yeah.
I'm just wondering if there's another part to the research, and actually, would it be interesting to be able to sort of maybe do something around GPs to look at people who use the internet to look at their symptoms and misdiagnose themselves and actually don't have lung cancer? And is the internet, because the internet can be working for good or for bad, isn't it? So, I can see what you're doing, it looks really interesting what you're going to do with the lung cancer patients. But what about those patients who use the internet, convince themselves they have lung cancer, go to their GP and don't ever get referred on to you?
I definitely think that would be interesting to look at as well. I don't know if I'm like in the frame of a 3-year project, but it's definitely something that would be interesting as well, especially in determining how helpful the information that's already there is. Because if there's lots of people who think that they have lung cancer when they don't have it, then obviously the way it's described online wouldn't be appropriate. So I think that could be important.
But even look at like patient history, like any psychological problems that they might have in the past, and also if they've had any other disease in the past, how that might interact.
Well, not really. My questionnaire will ask patients if they have any comorbidities, but not really looking at the psychological factors. Is there a specific reason why you think it would be important?
No, I just think like things like anxiety will probably stop them from going to the doctor.
Yeah.
Again, like you said. And also like if they've had something that could have cancer in the past, then that would definitely change.
Definitely, yeah. I could maybe think of including that specific